Hello, my name is Brooke Ponting, and I have done my signature assignment on lymphoma. Today I'll be discussing the etiology, demographics, anatomy, physiology and symptoms, diagnosis, treatment, and AI. For this slide, we'll be going over the etiology. So for non-Hodgkin's lymphoma, it's caused by a mutation in the DNA of a type of white blood cell called lymphocytes. The most common non-Hodgkin's lymphoma is the diffuse large B-cell lymphoma. So diffuse large B-cell lymphoma has two major molecular subtypes known as germinal center B-cell and activated B-cell. They're both genetically heterogeneous with different pathologic genetic alterations within the two subtypes. So GCB subtype genetic mutations include these 6 genes, while the most common is the ABC subtype genetic mutations, which include these 4 genes. Two mechanisms that damage genetic material is the chromosomal translocation, commonly occurring in BCL6, BCL2, and MYC genes. Aberrant somatic hypermutation causes multiple genetic mutations, especially in the PIM1 and MYC proto-oncogenes. The genetic mutations cause dysfunction during the immunoglobulin DNA remodeling process of the B cells, which unfortunately then leads to diffuse large B-cell lymphoma. So non-Hodgkin's lymphoma does have environmental and behavioral risk factors. So if you're someone who is exposed to certain chemicals and drugs like benzene, insecticides, you could be at a higher risk for having lymphoma. There are still studies that are going out right now linking them together. Radiation exposure, so if someone was exposed to like an atomic bomb, a nuclear reactor, you're definitely at a higher risk. Body weight and diet takes into account as well. So if you have excess body weight, you're eating lots of red and processed meat, sugary drinks, lots of processed foods, these could also be a risk factor for lymphoma. Anybody who has a prior autoimmune disease, such as like celiac disease, lupus, rheumatoid arthritis, these are also risk factors that could contribute to someone having or just being at a higher risk for lymphoma. Having a weakened immune system, maybe someone who has HIV, could be someone who has a genetically inherited syndrome like the Wiskott-Aldrich syndrome. Children who are just born with a deficiency in their immune system are also at a much higher risk. Infections that directly transform lymphocytes are human T-cell lymphotropic virus, the Epstein-Barr virus, also known as EBV, which is commonly known as the kissing disease. Herpes can also be a huge risk factor. If you already have had any of these or have them, you are definitely at a higher risk for developing lymphoma. There are some AI models that help assess risks. So AI, machine learning, and deep learning show a promise in detection of malignant lymphoma. This can be due through data extraction, quality assessment, meta-analysis, and mainly AI algorithm. So this is going to help doctors assess as well as, again, detect any form of lymphoma. It just makes it a lot easier through data collection. Here are a few statistics to take a look at. So in the US, about 80,620 people are diagnosed with non-Hodgkin's lymphoma. Most of them, or a higher percentage, is males. The chance that a man will develop a non-Hodgkin's lymphoma in his lifetime is about 1 in 42. And then for women, the risk is about 1 in 52. Outside the US, I found a few numbers in different countries that had higher numbers of people who have lymphoma. So Lebanon being the highest, so about 23.35 per 100,000 people will have lymphoma. And then you can see Australia and New Zealand follow. Unfortunately, lymphoma does not choose or have favorites. Anybody could be affected. It's most common in children and adults. And the most common is in early adulthood, so people in their 20s. However, once past your 20s, if you do not have any signs of lymphoma, unfortunately, you're not out of the clear, because the risk to contract, or not contract, but the risk to develop lymphoma rises again in late adulthood, so basically after 55. So overall, the average age of people when they are diagnosed is about 39. So lymphoma begins when healthy cells in the lymphatic system change and grow out of control. And you can see on the right-hand side diagram what makes up the lymphatic system. So your thymus, your bone marrow, your liver, your spleen, your tonsils. These are all part of our lymphatic system and organs that can be highly affected by lymphoma. The lymphatic system is part of our body's immune system, which protects against infections and disease. Now, on the left-hand side is a diagram of our lymph node clusters. Now, which is all this is all part of our lymphatic system as well, because throughout our lymphatic system we also have which are called lymph node clusters, which are bean-sized collections of cells called the lymphocytes, and there are hundreds of these node clusters throughout the lymphatic system, like in our knees, our necks, our pelvis, our groins, our armpits, and this is where a lot of times when the lymphocytes grow out of control, these are the areas that they start doing that first. And then, of course, then we start having our malignant tumors, and this is what then affects our lymphatic system. As explained before, lymphoma often arises in our lymph nodes. However, it can also be seen in our gastrointestinal tract, which is the most common system outside of the lymphatic system. Some other common involvement sites are the testes, eyes, and central nervous system. But of course, this can be present anywhere in our body. Some common signs and symptoms of lymphoma can include fever, night sweats, fatigue, itchy skin, some swelling in the lymph nodes, pain in the chest, abdomen, and bones, and of course, losing weight without trying. The survival rate for non-Hodgkin's lymphoma has gone up. So the overall 5-year survival rate for people with non-Hodgkin's lymphoma is about 74%. But of course, this also depends on the stage of cancer. About 20,000 people die from cancer, the highest being males. To properly diagnose lymphoma, there needs to be a biopsy. So a small piece of the lymph node or even the entire lymph node will be removed, where pathologists can examine the tissues and cells. Some common treatments are chemotherapy, radiation therapy, stem cell, which is bone marrow transplant as well. Some common side effects for chemotherapy is anemia, bleeding, constipation, diarrhea, fatigue, hair loss, higher rate for infections, loss of appetite, nausea, and vomiting. For radiation, some common ones are fatigue, nausea, vomiting, diarrhea, headaches, skin irritation, dry, itchy scalp, hair loss, mouth sores, pain when you swallow, and then also reduced appetite. And your stem cell transplant, the common side effects would be just infection. Through machine learning algorithms, this is helping improve patients' treatment decisions, as well as prediction of chemotherapy efficiency, drug discovery and response prediction, which has and been helping lead to higher rates of survival. So currently, right now, more than 80% of all patients that are diagnosed with Hodgkin's lymphoma can be cured. And the cure rate is higher, which is now approaching 90% in younger patients and those with early stages as well. And that concludes my presentation. Thank you so much for listening.